3D printing is a huge advance for patients with bone sarcoma. We can actually take their MRI and their CT scan that shows us the size and the area they're involving their tumor, and we can take a image, download it to a 3D printer, and we can make a model that's the exact size and dimension of their tumor. We can then plan with engineers to show exactly where we want to cut the bone, if we want to cut it in a special angle or in a unique way. And then we can also take a cadaver bone and replace that area where we take it out using a cutting guide that exactly matches the guide we used for the tumor, so that basically what we take out, the cadaver bone goes exactly back in as the exact size and shape to allow for better bone healing, faster bone healing, and better care for the patient.